The liver, it is the largest and most important metabolic organ in our body. Most of us do not feel it throughout our entire lives.
A healthy liver is not noticeable. Unfortunately, a slightly inflamed or chronically inflamed liver is also not truly noticeable in most cases. At most, one may have slightly elevated liver values, but actually no symptoms. The symptoms become noticeable when the liver is significantly altered, when we have liver cirrhosis.
Such symptoms often include ascites or patients being admitted to the clinic with major issues in the esophagus.
Many people are walking around outside probably not even aware that they have liver cirrhosis, and then complications arise such as bleeding from the esophagus, where one does not primarily think of liver cirrhosis.
Why does liver cirrhosis cause bleeding in the esophagus?
If you have liver cirrhosis, it becomes fibrous, the liver becomes hard, and then you can't press well into a liver, which is visible here. Here you have a rough surface, you have many nodules on this liver, and then the liver is hard, which is a fundamental issue in liver cirrhosis, because ultimately it also means that blood cannot flow easily through the liver. The blood backs up, we have a blood congestion, and as a result the pressure in this vessel becomes correspondingly high. And this pressure leads to the formation of small new blood vessels. These vessels grow towards the esophagus, towards the stomach. And of course these are not normal vessels. And if you have high pressure in an abnormal vessel, such a vessel can easily rupture, causing the patients to experience bleeding. And these hemorrhages pose a life-threatening risk.
To prevent bleeding from these new vessels, small rings are placed around the varicose veins. Another common effect of liver cirrhosis is water in the abdomen, just like in Gunther Zimmermann's case. He had copious amounts of ascites in the abdominal cavity.
In the past, the abdomen was filled with ascites. You had to undergo paracentesis to remove it. The amount of ascites removed was 12 liters.
12 liters were drained previously. Often patients are unaware they've had elevated liver values for many years, not taking the initial warning signs seriously.
Liver function test results are frequently elevated, but this may not always be perceived or consistently monitored. And unfortunately, in this case, it leads to a complication, abdominal fluid accumulation. The patients feel this. The pants are getting tighter and the stomach feels uncomfortable, and then you go to the doctor and then the diagnosis of liver cirrhosis is made.
What are the causes of liver cirrhosis? Alcohol might be at the top of the list, but it is not the sole cause of liver cirrhosis by any means.
This unfairly implicates many people because, of course, alcohol leads to liver cirrhosis. However, there are many other liver diseases, chronic liver diseases, with fatty liver being one of the most prevalent.
And if in addition to that, there is also alcohol consumption that is just slightly above the recommended limit, it is sufficient to result in liver cirrhosis within a period of 10, 15, or 20 years. These are often individuals accustomed to consuming 2 or 3 glasses of wine in the evening for dinner. However, if one does this on a regular basis over a period of years, decades, it can be excessive.
What are the available treatment options? A liver cirrhosis that develops gradually over the course of several years is no longer curable, as it has become a well-established condition.
So liver cirrhosis is essentially the final stage of a gradual transformation of the liver and is in fact a condition that can be effectively managed through proper medical care and lifestyle modifications. Here too, the underlying condition should be treated to prevent it from progressing further, to keep it stable, and to prevent further complications. However, reversing liver cirrhosis itself is extremely challenging.
In the treatment of complications caused by liver cirrhosis, a TIPS procedure initially developed in Freiburg plays an important role.
So we are now here at the TIPS facility, and the TIPS facility provides a minimally invasive procedure for lowering portal venous pressure. As we have already heard, when we have liver cirrhosis, the liver becomes very hard, blood flows extremely difficultly through the liver, and we then need to lower this pressure by creating the connection between the portal vein and the hepatic vein.
In the course of this operation, such a stand is employed for the purpose of support.
Once the stent is inserted, it passes through the liver and then connects the hepatic vein to the portal vein, allowing the blood to then take the path of least resistance through the liver, thereby reducing and significantly lowering the pressure in front of the portal vein and facilitating improved blood flow within the hepatic system.
a complex procedure aimed at minimizing the complications of liver cirrhosis. A significant number of cases of liver cirrhosis could be completely prevented with proper measures.
So crucially, one should check the liver values once or twice during the course. This is now offered at age 35. Consider your 35th year as a health check, and if you have elevated liver values, please take it seriously. Since nearly all causes of chronic liver disease can be treated very effectively, it is possible to prevent the development of liver cirrhosis. And in prevention, naturally, the utmost important aspect is that we achieve success in this. So avoid liver cirrhosis by timely diagnosing the disease and effectively treating it.